Stop sleeping like that. Seriously. The position you've been using for decades could be quietly harming your body without you even noticing. The worst part? You won't feel the effects until the damage is already done. For anyone over 60, the way you sleep isn't just about comfort anymore. It affects your heart, your spine, your brain, and even your lifespan. A major study in the Journal of Clinical Sleep Medicine tracked more than 12,000 adults over nearly 10 years. The results were shocking. Certain sleeping positions raised the risk of heart problems by up to 34% in older adults, just from the way you lay your body at night. And it doesn't stop there. Research from Stony Brook University found that sleeping in an unhealthy position can reduce the brain's ability to flush out toxins by over 40%. These toxins include amyloid beta proteins, the same proteins strongly linked to Alzheimer's disease. So even while you think you're resting peacefully, your brain could be accumulating harmful substances every night. The good news? Scientists have also discovered the positions that protect your body, positions that improve circulation, support your spine, and help your brain clear waste efficiently. The best part is that these changes are free. You don't need special beds, medications, or expensive devices, just the right information. In this video, I'll walk you through 4 sleeping positions that people over 60 should stop using immediately, and the safe alternatives you should adopt. I'll explain why each position can be dangerous, how to adjust it, and share real numbers from clinical studies so you can see just how much difference these changes make. We'll start with number 4 and work our way to the most critical position. I saved the best for last. A 2023 Stanford study found that adjusting this one position reduced nighttime oxygen drops by 61% in seniors with breathing issues. 61%. That's huge. Stick around for it, it could truly change your life. Before we start, drop a comment below with your age and where you're watching from. We read and respond to every comment, so we'd love to hear from you. Number 4. Stop twisting your torso, use an aligned spine. The twisted torso is a sleep habit most people don't even realize they're doing. This happens when your shoulders and upper body face one direction while your hips or legs point the other way. Maybe you sleep on your back but your knees fall to one side, or you lie on your side and your shoulders twist toward the ceiling. This creates a spiral through your spine. When you're younger, your spine can handle occasional twisting. Discs are supple, muscles recover overnight, and soreness is temporary. After 60, though, your discs start losing hydration, flexibility declines, and recovery is slower. A study in Spine Journal of over 300 adults, aged 60 plus, revealed that 72% already showed significant disc degeneration in the lower back. Twisting your torso while you sleep accelerates that degeneration. The problem is uneven pressure. One side of your spine becomes compressed, the other overstretched. This can inflame your facet joints, the small stabilizers between vertebrae, leading to stiffness, chronic pain, and morning discomfort. Johns Hopkins research found that seniors sleeping twisted were 2.3 times more likely to wake up with back stiffness lasting over 30 minutes. Twisting can also compress internal organs. The stomach and intestines may be pressed unnaturally, causing acid reflux and digestive issues. Research in the American Journal of Gastroenterology showed that seniors who slept twisted experienced 47% more nighttime heartburn than those who maintained spinal alignment. The fix? The aligned spine. Keep your shoulders, hips, and spine facing the same direction. Place a pillow between your knees to prevent rotation, and a body pillow behind your back to avoid rolling onto your back. Ensure your mattress supports your body's natural curves. Medium firm works best for most older adults. Oklahoma State University found that switching to a medium firm mattress reduced back pain by 48% in just 4 weeks. A contoured neck pillow helps maintain alignment from head to pelvis. Number 3. Keep your arms down. Stop sleeping with them overhead. Many people raise their arms above their head while sleeping, whether tucked under a pillow or stretched upward. While this may feel comfortable at first, it can compress nerves and blood vessels in the shoulders and upper arms. For those over 60, this is risky because of thoracic outlet syndrome, a condition where nerves and vessels pass through a narrow space between your collarbone and first rib. Age-related changes narrow this space further, and sleeping with arms raised makes it worse. A Cleveland Clinic study followed 180 seniors who complained of hand numbness or tingling. 63% regularly slept with arms overhead, and after switching to arms down positions, 71% saw noticeable improvement within 6 weeks. Overhead sleeping also stresses the rotator cuff muscles, which stabilize the shoulder. Tendons become less elastic with age and are prone to tears. The Journal of Shoulder and Elbow Surgery examined over 500 adults, aged 60 to 80, and found 40% had some rotator cuff damage, often unnoticed until aggravated during sleep. Sleeping with arms overhead strains these tendons for hours nightly. The solution? Keep arms at your sides or resting lightly on the chest. Use small pillows or a body pillow for support. Gentle shoulder stretches before bed, like doorway stretches or shoulder rolls, can reduce nighttime repositioning by 38% in seniors. Number 2. Left side sleeping. Stop right side sleep. Sleeping on your right side seems harmless, but for those over 60, especially with heart conditions, it can increase cardiovascular stress. Your heart is slightly left of center. On your right side, gravity pulls it toward the right lung, which slightly increases workload. Echocardiography research in the Journal of the American College of Cardiology showed that right-side sleeping increased cardiac volume by 8%. For healthy young hearts, this isn't serious, but for aging hearts or those with heart failure, it can add strain. An International Journal of Cardiology study of 240 heart failure patients showed 23% more hospitalizations among right-side sleepers over 3 years. Right-side sleeping also affects digestion. The stomach and pancreas lie on the left. Gravity isn't helping when you're on your right side, which leads to more acid reflux. The Journal of Clinical Gastroenterology found 40% more reflux episodes in right-side sleepers versus left-side sleepers. The fix? Sleep on your left side. This eases heart workload, promotes proper digestion, and enhances lymphatic drainage. To make the transition, use a body pillow behind your back to prevent rolling to the right, and place a pillow between your knees for hip alignment. Elevating your head 30 degrees further reduces reflux by 90%. Number 1. Elevate your upper body. Stop sleeping flat on your back. If there's one change that can truly save lives, it's this. Don't sleep flat on your back. Flat back sleeping can cause your tongue and soft tissues to fall backward, narrowing your airway. Young muscles handle this fine, but as we age, airway muscles weaken. The American Academy of Sleep Medicine found that adults over 60 experience 33% more airway collapse during flat back sleep. This leads to sleep-disordered breathing, snoring, and sleep apnea, which are far from harmless. Oxygen levels drop, the brain partially wakes you dozens of times each night, and over the years this increases the risk of cardiovascular disease. The New England Journal of Medicine reports that untreated sleep apnea raises heart-related death risk fourfold. The Stanford study found that elevating the head 20 to 30 degrees reduces oxygen drops by 61% in seniors. That's life-changing. Elevated back sleeping also reduces acid reflux and helps the brain clear toxic proteins, like amyloid beta. Stony Brook University research shows flat back sleeping reduces brain clearance efficiency by 40%. The fix? Elevate your upper body 20 to 30 degrees. Wedge pillows or adjustable beds work best, and combining elevation with left-side sleeping gives the greatest benefits for the heart, brain, and airway. If you don't have an adjustable bed, stack firm pillows or use a foam noodle under the mattress for a gentle incline. Start gradually, 15 degrees the first week, then increase. Most people adjust in 2 weeks. Recap and takeaway. For twisted torso, aligned spine. Prevents spinal stress, disc damage, and digestive issues. 3 arms overhead, arms down. Protects shoulder tendons and nerves. 2 right side, left side. Reduces heart strain, improves digestion, and supports lymphatic drainage. 1 flat back, elevated back 20 to 30 degrees. Opens airway, reduces reflux, improves oxygenation, and clears brain toxins. These changes cost nothing, have no side effects, and require no medication. Yet research shows they dramatically reduce risks of heart disease, cognitive decline, back pain, and sleep disorder breathing. Here's a challenge. Pick one change tonight. Master it for 2 weeks, then add another. Within a couple of months, your sleep and your health can transform. Sleep is when your body repairs, your brain consolidates memories, and your heart finally rests. Don't let a simple sleeping habit undermine all that. If this helped, share it with someone over 60. They may not know that small adjustments can have life-changing effects. And talk to your doctor before making big changes if you have medical conditions. Sleep smart, sleep safely, and your future self will thank you. Now I want to hear from you. Which sleep position have you used for years that might be harmful? Are you ready to make the switch tonight? Comment below, I'd love to know.